like so, okay? So we're hip flexing and then abducting. Contact right above knee. Keep his knee straight. If I let his knee bend, then we'll take some tension off of it. And what I'm going to do is, as a traction tension glide, I'm flexing and abducting him. And I'm with my hip. I'm actually blocking his other leg
From external rotating?
more than that. Sliding and falling off the table, basically. So again, you guys have to find your path of most resistance. Is it a little bit more adduction? Is it a little more flexion on him? He's getting a little bound up there. So just sort of find where it is, where that greatest tension is, and then we're going to bow and arrow him. Okay? Some people will pinch. We have to still deal with that aspect of it. Okay, come on your side. You guys are going to go through 2, back to back. Okay, side posture. This is probably, I'd have to say for me, the most difficult area for me to get. Right in here, where you've got TFL, glute medius, glute minimus, and tons of really dense connective tissue. It's really hard. So I'm going to show you guys probably the easiest way to learn to do this. Greater trochanter. Iliac crest, okay? We're working the tissues in between. What I want you to do is abduct. We're really slacking everything, okay? Find greater troch. And if you want just to feel at first, it's fine with the thumb. Okay, I'm gonna compress in and then tension it superiorly as I traction, okay? It's really difficult to draw the tension with your thumb, so I'm gonna come in with my elbow. Okay, and I'm really moving medial superior as I traction him. Okay, and you got to play around a little bit. You might need to slide a little more anterior, add a little bit of extension traction. Tell them what you feel.
I feel tension not only where his contact is, but also in the medial aspect of my leg.
Okay,
all the way around the hip joint.
Once I get that tissue starting to release a little bit, then from there what I want you guys to do is grab their pelvis and then take it through a stretch, or hop them off the table and take them through some excursion, okay? Because we're slacking tissue, we're not creating tension in it, and we need to get the tension out of it once we work through it. Okay, so if you like, you can just take them through stretch. If you really want, you can try to take a contact through stretch. It's really difficult because it's going to kick you right off. Okay, especially if they're really ropey and wiry. So for now, let's just do it this way. Get that leg up there, relax. Find greater troch between iliac crest. I'm going to traction out as I'm compressing intensity, medial superior. Okay? You might have to move anterior. I'm repeating myself here, but I want you guys to feel this. Don't neglect this area, it's really important. And I'd have one hop up and get into it.
He's scooping. We do a lot of scooping. He locked in and he scooped superior while his other hand was tractioning inferior. And I felt it all around the hip, all the way. It was nervy, all the way around through here. So a lot of people get symptoms up in here. You have to remember all the neural tracts. Okay, so important. We'll practice with you.
The first one you showed us.
Because you can easily just smash into the tissue and it's not going to be nice. But Vince was actually very aggressive, but in a subtle way, because he was scooping and tractioning at the same time. That's why we keep saying traction, tension, glide.
Can you just review real quick what all that was? There was a lot there.
Yes, come on your
I'm
back.
sorry. Thank you.
So basically, in this position, I work from his knee to his greater trochanter. When I turn him side posture, I went greater troch to crest, right? Come on your back again. So we're kind of working the whole lateral, but I had to break it up because you can't get through the whole thing. So just start here. Straight knee, find that tension, flexion, adduction, wherever it may be. I can come in here and come through these structures and do this well, but I don't want to teach you guys that. It's a little challenging. So we just broke it up from that and then side. Just really relax that. Get your contact. Traction, scoop.
good.
and find, sometimes too, I'll just do little circles, whatever I need to do, and then they've got to get up and tension it, or you need to tension it for them. There's no way you can generate the force yourself that he can put through himself. It's impossible. So Lenny's the type that will immediately get him up and do it. Okay? I'll work with you right now.